Hi, my name is Richard, Physiotherapist at Active Therapy. Today I wanted to talk about one of the most common questions that I get is regards to sleep. What position should I be sleeping in? So when I answer this question, what I'd like to know is what position people prefer to sleep in, and then try to go into a position that's realistic to adapt to. So how do you know if you have a problem with your sleeping position? The first thing you should look for is if you wake up in the morning and you have a lot of stiffness, takes a while to get going, especially if you have a lot of pain, and you didn't have something the day before or there's no other reason to explain it, that might mean that it's an issue with the sleeping position. You could also have a look at your mattress and your pillow. If your mattress and your pillow are appropriate and they're fairly new, it's also more likely that it's a sleeping position issue rather than an issue with the mattress or the pillow itself. So the two positions that I believe are okay to sleep in would be sleeping on the back or sleeping on the side. So if you're sleeping on the side, typically it's going to be a little bit more easier if you have a particular type of back issue or a lower leg issue, or if you have a neck issue, as long as you have the right pillow. Sleeping on your back is also okay, as long as you have a reasonable mattress that's supportive. And particularly if you have a shoulder problem, it's difficult to sleep on your side, so sleeping on your back would be a better option. Now, when it comes to sleeping on your back or on your side, one of the things that I encourage is to make sure that you have good alignment. So if you're sleeping on your side, have one leg on top of each other and preferably a pillow in between your knees, and not have one leg rolled over towards the front, or be in a position where your head might be facing the side but your back is almost rolled over onto your back. Similarly, if you're sleeping on your back, what I encourage is to have your legs straight, sometimes having a pillow underneath both your knees, rather than sleeping on your back and have one leg and hip turned all the way out to one side, or sleeping on your back and have your neck turned away all to one side so you're looking in one direction. Most people will find those two positions quite healthy. The position that a lot of people sleep in and is often unhelpful or can often aggravate pain will be people that sleep on their stomach. One reason why some people do that would be because they snore, so that they end up on their stomach, or they've just gotten used to that position over time. And the issue with this is that it's very difficult to maintain good alignment if you're on your stomach. Unless you have a bed that has a hole in it, you're lying on your stomach with the head over to one side, usually a hip turned out. So it's unlikely that you're going to have fairly good neutral alignment with your neck, your shoulders, and your lower back. So if you're someone that's a stomach sleeper, what I recommend is looking to lie on your side, facing the same way that you would if you're on your stomach and your head is facing in that direction. And it's usually a bit easier to transition to a side sleeping position if you're a stomach sleeper, rather than trying to sleep on your back. It's likely that you're not that used to it and it's going to be difficult to try to make that transition. So that's what I recommend in regards to sleeping position. If you're still having difficulties, even if you have quite good sleeping position, then at that point you might have a look at the type of pillow that you use if you're having problems with your neck, or have a look at the mattress itself if it's quite old, or if you feel that's not supportive and you're having issues with your shoulder or your lower back. Typically, a very firm mattress is a little bit more suited to someone that sleeps on their back, because it places a lot more pressure if you're trying to sleep on your side. Whereas for a side sleeper, you want something that's a little bit more medium density so that there's a little bit of give for side sleeping. See how that goes. If you have any questions about that, get in touch with us or have a talk to your physio. I hope you found that helpful.